AM 560, The Answer.
Get the latest weather, traffic, and news updates online at 560theanswer.com. Now, from the Signature Bank Studios. If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
Top of the morning, Dan Proft here. So, dietary supplements, huge business sector. And part of the conversation, I guess, under the umbrella of MAHA, Making America Healthy Again, right? We're pleased to be joined by a senior nutrition educator at Now Foods. Now Foods is located right here in Bloomingdale. One of the largest, maybe the largest independent maker of food supplements that is family-owned and privately held. Neil Levin, thanks for joining us. Appreciate it.
I'm glad to be here. Thank you.
Maybe just pull that mic a little closer so we can hear you better. There you go. This is really interesting, just reading up on Now Foods, that you guys have been essentially a whistleblower with respect to fraudulent dietary supplements that are being sold on Amazon and online elsewhere. Tell us about that.
Yeah, since 2017, we've been doing a series of tests of no-name El Cheapo products sold on Amazon that are too good price. Maybe the price is below the wholesale we can pay for it, and we're a huge purchaser with a lot of purchasing power, or too much potency. So we test them in our own labs. Our labs are International Standards Organization certified, so we have a good accreditation. We also send it to a third-party lab for confirmatory testing, both our product in that category and competing products. And we don't test our normal competitors. We're testing these guys who are cheating. And most of the products are failing. We notify the FDA. We notify Amazon. Some of the products we've tested a couple of times, maybe 2 years apart. They're still on the market. They're still being sold. There are no regulatory actions to do this. We're taking a risk. It's a financial risk. We're doing the testing. We're paying for third-party testing. We're risking being sued by companies, and we're seeing no action on that. And last year, one of the congressmen, a Republican from South Carolina, sent a letter to the FDA. How come you're not doing anything when you're presented with this evidence that fraudulent products are out there? And basically the response is, well, we don't listen to hearsay.
And right, and you're doing you're paying for it and doing the medical test. I mean, the testing on the scientific testing on it too. Right. So they're fraudulent in the sense that these are placebos, or they're fraudulent in the sense that they're potentially dangerous.
Well, some of them could be dangerous. They don't contain what they say on the label. Some of them have had junk in there, cellulose or something non-active. Other ones have a fraction of what they're labeling, and they're charging the price for. One of the problems is that if someone buys this, they might think that supplements don't work. I tried it.
Yeah. Well, the other thing, I mean, it's interesting you bring this up because I was reading about this too, talking not just about dietary supplements, but muscle building supplements too. A buddy of mine who, is a caddy that I know, he was hospitalized for 60 days last winter because he was taking sort of these cheap knockoff, what he thought were muscle building supplements. And whatever was in there, it gave him a serious case of pancreatitis. And so he was hospitalized for, as I said, 2 months. It was pretty bad. And so this just talking about the sort of things that are out there that you're trying to police. I suppose I'm putting words in your mouth, but I suppose this is, in the interest of quality control for your industry.
Yeah, we're self-policing at our own risk and our own cost. We're trying to get regulators to do that. And our industry for decades has been asking for more funding for the FDA for enforcement regulation, to do more audits. Why haven't they gone to these companies and audited them for good manufacturing practices required by federal law and shut these guys down? Why haven't they recalled the products? We want action. We want enforcement. How many industries come to you and tell you that?
Right. Are you seeing any better movement under the Trump administration than you have previously?
Well, we definitely have more access. Our CEO, Jim Emmy, great guy, and He's now the president of the Natural Products Association, and he and the executive director, a former director at FDA for supplements, have gone to the White House, have met with RFK Jr., and now are telling them about these issues so that we're hopeful the new administration is going to finally take action on this.
So now, on the one hand, there's a lack of oversight, and on the other hand, I understand there's too much regulation in terms of censorship, right? I mean, that's an issue in the industry as well.
Yeah, there's a real freedom of speech issue. There's now a lawsuit to try to force the FDA to accept 118 different health claims that are based on publications by federal agencies that the FDA is not allowing for us to put on product labels. If you mention anything about a disease on a label, it requires FDA approval on a supplement. Any disease claim makes a product a drug unless they specifically authorize an exception. There's only a handful of exceptions. Most of them have gone through because of lawsuits. And now there's a massive lawsuit trying to force them to accept other government agencies' conclusions that supplements have a role in health and preventing or mitigating disease.
So tell us how that works. So like the Department of Agriculture investigates a supplement and draws a conclusion, and they put out a paper that's peer reviewed on it. And then you want to say, well, we've got this peer reviewed paper that says our supplement or this category of supplements has these beneficial health effects, and we want to include that on our marketing products. And the FDA says no. Is that basically it?
They typically turn down almost every application.
And I mean, is there any explanation, or it's just sort of the imperious government agency that just, gives you the Caesarean thumbs up or thumbs down?
They kind of want the drug standard of 2 clinical studies, large populations on a specific product. And they really like single ingredients more than formulas. Just like drugs, they want to approve a substance rather than a product.
Right. Okay. And then what is your interaction, a company like Now, what is their interaction with other federal agencies or with maybe academic or research institutions that will do studies on products as well?
Well, we do sometimes donate products to universities for studies. We have no real control over the makeup of the study, how it's set up. But, our products have been used in literally hundreds of studies. And some of them, for example, there's a study at a university in California on one of our products showing a benefit for osteoarthritis, as effective and fewer side effects than a medication. We actually are mandated to make that claim on the product in Canada. We cannot make anything like that claim in the United States.
You have to make it in Canada. You're not allowed to make it in the United States.
Exactly.
That's interesting. And so, do you explain this in part or maybe in whole because of the political influence of big pharma, or what is it?
It's partially big pharma, but they do own some of the ingredients and some of the brands.
Yeah, okay.
But it's also a lot of the medical professionals are not trained in nutrition, which is one of the things that the current Health and Human Services is trying to get through, is mandate more nutrition training for doctors. So if your only tool is a hammer, all your problems look like nails. Doctors are trained in surgery and drugs, not necessarily nutrition. So they kind of poo-poo and negate that there's any benefit because they really don't know.
And so, are you encouraged by sort of RFK Jr.'s posture to look at childhood obesity and other systemic illnesses in children and have a broader conversation about the sorts of approaches and products potentially that should be used?
Yeah, we do support that holistic view.
And so now the censorship claim. So now that's sort of the same process. So on the one hand, you're trying to get to Macari and the decision makers at FDA on going after providing oversight on people that are making fraudulent claims. On the other hand, you're trying to get them to unlock your ability to make scientifically back claims. So, it's sort of like in typical government fashion, they seem to have it wrong on both sides.
Yeah, there's less freedom of speech commercially than there is for general people.
Sure, right, okay. To some extent that one would suspect that, but I mean, to a point of rationality, that's, or to a point of irrationality, I guess, is the problem. So what about, your perspective on the very popular GLP-1 weight loss drugs that seem to be all the rage?
Well, I think they work short term, but we're seeing a lot of side effects and problems with people using them long term. So we're looking at more natural alternatives to try to hit those same pathways. But of course, people eating a more holistic diet, like the MAHA type program, is probably a more sustainable way to go. Instead of people just keep eating the same junk and cutting out some of it, eat more healthy.
No, but I mean, it was, so it's like, what do we know about the medium or long-term side effects of Ozempic and these other weight loss drugs? Are we still sort of in the infancy of full understanding, or do we have a pretty good idea what some of the pitfalls are, potential pitfalls?
Well, we're starting to see things like people are not getting enough nutrients because they're cutting out a lot of foods, and they're cutting out healthy foods, not necessarily unhealthy foods. So, their nutrient profile is not necessarily going up. They're not necessarily supporting their health any better. They're sometimes hurting their health, and then they're getting other side effects affecting metabolism and things like that. So the downstream things, how it's affecting neurotransmitters or hormones, have not really been looked at closely enough yet.
So what is on something like that, like supplements and nutrient-rich diets, and then pharmaceutical drugs, like what is the relationship between a company like Now and some of the big drug makers? Do you have one? Are there collegial conversations about some of these public health issues, or is it two very different approaches, and so sort of never the two intersect?
Some of the pharmaceutical companies make ingredients that we purchase and actually have their own brands of vitamins. So we do interact with them in sense of working with them on industry trade associations. We actually develop some of the testing methods, the assay and quality methods used by industry in our own labs and publish them. And so these companies are sometimes also using our methods, and they're working with our scientists on these committees. So we do have relationships with a lot of these pharmaceutical companies, but of course their interest is more on trying to protect their own business and their own market share.
What you hope to come out of, it's a short term, at least just with the horizon of President Trump's second term here. What is it, other than those two issues we discussed with the FDA? What is it you hope will come out of the MAHA effort within these public health agencies on a go-forward basis, that will sustain on a go-forward basis?
Yeah. Well, one thing is we've been able to get some reasonable exemptions to the tariffs for essential nutrients, but there's a lot of other things that are covered in health besides vitamins and minerals, the botanicals and things that are not covered. So we're trying to work with them on this. But there's also, we're looking at this emphasis on nutrition training for doctors, on people eating more healthy, and getting the food companies, which is actually happening, to cut out these artificial ingredients that are maybe responsible for some of the behavioral problems in children, for example. So that's a very, very positive move.
He is Neil Levin. He is a senior nutrition educator at Now Foods. Again, Chicago, Bloomingdale-based, family-owned business. Been around since 1968. 1968, one of the largest independent, privately held food supplement businesses in the country. Neil Levin, thanks so much for joining us. Appreciate it.
My pleasure.
Hear about the big stories of the day, then talk about them right here on Chicago's Morning Answer on AM 560. The Answer.
Sean Thompson here, and I'm with attorney Bert Hochberg from the law firm of Schiller, Ducanto, and Fleck. We're talking about divorce arbitration. This is not really a new, or is it a new, innovative way to go through divorce?
Arbitration has been around for decades. It's completely legit and available to resolve divorce cases. The litigants and their lawyers sign an arbitration agreement. They identify what the issues are, and we set up dates, and we determine what experts and witnesses there may be. Arbitration is a hearing, a trial that is intended to finish a case efficiently with limited appeal appeal with a binding decision, and it's confidential.